Up next, we have another power-packed keynote presentation on Urgent Consultation Center during COVID pandemic by Dr. Khalid Abdelhadi Ali Awad, Clinical Fellow, Endo urologist, Hamad Medical Corporation. I welcome you, Dr. Khalid, and the stage is all yours for your keynote presentation.
So my name is Khalid Abdelhadi. I'm a clinical fellow of endourology at HMC. Today I will be presenting on the behalf of my director, Dr. Khalid Rmehi, who couldn't attend the summit because of an emergency matter. I was actually one of the creating members of the urgent consultation service. So I will be talking today about our experience. It's the Urgent Consultation Center, which we abbreviated as UConsult or UCC. As we all know, at the beginning of the pandemic, there was a lot of confusion in the health system to balance between applying social distancing rules and allowing patients to be seen physically in the emergency or the outpatient department for non-COVID related illnesses. Innovation played a key role to come up with a service where patients seeking medical help can call a dedicated hotline without pre-registration for a telemedicine consultation. The aim of our project was to decrease the patient visits to the emergency and in order to decrease the patient exposure to possible COVID infection and also to decrease the staff exposure to possible COVID infection, as we know that health workers were very valuable assets during the pandemic. And we also aim to provide a channel for patients without a near appointment and those who have medical queries and those patients with chronic illnesses that needed refill for their medications without coming to the OPD. So timeline of the UCC: on the 19th of March, the CMO decision was to create the service and a hotline for urgent non-life-threatening consultations. And on the 29th of March, we went live with the service. And in August 2020, the HMC administration decided the service will be permanent. So in the operational committee, our duties at the beginning was to create the service, to supervise day-to-day operation, and to problem solving and improvement of the service. As we all know, in Qatar, we had a common number, 16,000, as mentioned by my colleague, Dr. Khalid. It was for all COVID, PHCC, Hamad Medical Corporation. So we had option number 3, and then number 1 for medical services. Number 2 was for the pharmacy. We were located in Barwa Tower 3, 19th floor. We had 3 flats open for us to accommodate more people with doctors with proper spacing. And we were able to recruit 15 physicians with medical background during that time to start working. They were in Qatar at the time. And then we started the service immediately. So from the 29th of March until July, for the first 4 months, we had long hours, almost 15 hours from 7 a.m. to 10 p.m. daily with no days off. And then we tapered down. We had Friday off starting on 1st of July. And then the service was from 7 a.m. to 7 p.m. And right now from October 2020 until now, we're doing a regular service from 7 a.m. to 3 p.m. Sunday to Thursday, 5 days a week. So upon the creation of the service, we had 11 subspecialties, as you can see here with us: urology, orthopedics, ENT, general surgery, obstetrics and gynecology, general medicine, cardiology, dermatology, pediatric, dental, and psychiatry. Later on, we added 4 more specialties because of the patient need, like neurology, pain management, geriatric, and medical oncology, hematology. All department heads were contacted to provide a senior physician to support the service. Around 150 physicians are covering the service either totally dedicated or as additional duty. Of course, we had some challenges during the creation of the service. As we all know, the majority of services in Qatar are provided by HMC and PHCC. And we both use the same electronic medical record, the Cerner. So it was giving us a very good advantage that all patients can be accessible, the medical records for them, so we can solve their problems. We had to make links to these specialties as well because we had many calls so we had to make channels to reach them, like the infectious disease team, the dietitian, the Qatar Metabolic Institute, home care, Sidra, and store and the pharmacy. We had some challenges and achievement during this time. in the urgent consultation service. For example, we were faced with restricted medication and non-formulary prescriptions. So we had a contact directly with the pharmacy, and we were able to provide these medications directly from the urgent consultation through the phone to the pharmacy so they can dispense it to the patient. And we were able to create a designated medical cerner for the service, which was called an encounter, which was called the urgent consultation encounter, and marked the referral as urgent without going through triage. We were able also to create a new health card number for those visitors who had no previous record in the health system in Qatar. And we were able to coordinate with the store to facilitate delivery and dispensing of the store items for Qatari and non-Qatari patients. And during the first wave, we were able to capture around 1 to 10 unattended COVID cases daily, and we were able to direct them to link them to the appropriate channel in the MOPH or the CDC for follow-up. So these are the statistics. As we all mentioned, that the data is very important for our work in telemedicine. We received around 406,000 patient call attendance since the beginning of the pandemic until the 31st of March in 2 years. As we can see here, divided by specialties, of course, medicine is on top, and then coming down to the different specialties. Here we can see the volume of number of calls attended by date. So as we can see here, in the first wave, we had a surge of calls, and then the second wave, and then the last Omicron wave, it increases the number of calls during the wave. Here we can see in the pie chart the division of the patients that they call our service according to nationality. 40% were Qataris, and 33% were Arab, and 28% non-Arab. So it was the group. And here, as we can see, the call distribution by specialty. And here, this is the triage response rate compared to the call volume. As I mentioned before, here in blue is the called, and in orange, the attended calls. During the wave, we can see there's a surge of calls. So sometimes the response rate will drop, but it never drops below 90. Here, the second wave and the last wave is the Omicron, and then it picks up immediately. The average response rate was around 95%. So we conducted two patient satisfaction survey. The first one was done in June 2020. And as you can see here, the majority, we called around 1,000 patients to ask them 5 questions, main questions. The majority of patients, they reported very good to excellent, around 88% of patients of the service. And upon asking them if they wanted the service to continue after COVID-19, 90% of these patients recommended that yes, the service should continue. And we asked them if the service was not available, what would you do? So as you can see here, 58% they said they will go to the emergency. So these are all patients that could have gone to the emergency and congested the system, but we were able to pick them up and solve their problems. 18% they said they will go to a private center, and 16% they said they will go to an OPD walk-in without appointment, and 11% opted to stay at home. This is the last survey just done last month in March 2020, and it was a more specialty-oriented survey. As we can see, more than 86% were very satisfied or extremely satisfied with the service. And again, upon asking them if what will you do, again, 30% said they will go to the emergency, and 37% they said this time they will go to the OPD. 13% they will go to private, and 3% will stay at home. 15% they said they're not sure, and actually their response was they're not. They will be in trouble if they did not have the service. So regarding our new scope of service in the UCC, we are trying to provide a general advice and guidance for the patients. We are referring patients to the emergency department when needed, and we start the initial treatment. We request the initial investigation, and we refer for the OPD. We can do medication refill, especially for patients who are having a very far appointment. As we know, this is a common problem here in our hospital in Hamad Medical Corporation, to avoid walking to the clinics. But as we all know, the telemedicine does not substitute the OPD appointment for some services. And also we are confirming the patient has a follow-up appointment to ensure the continuity of care, because our system enables us to see the next appointment for the patient, so we can assure them that they are having a continuous follow-up with the respective specialty. And lastly, we review the lab results for patients having far appointments. On many occasions, there were critical lab values that were discovered through the urgent consultation service, and the patient were referred to the emergency. Here are some of the aspects that we are planning for the future of the telemedicine service after the COVID-19 pandemic. For example, the aspect of media, we can improve it by distributing roll-ups in HMC facilities, including the pediatric emergencies. We're sending SMS through the HMC system to community to promote the service. We can improve this response rate by daily monitoring of the triage team, calls response rate. And we can do live monitoring of the specialty response rate and call them if there is any issue, any technical problems. We have a very good support from the IT department. And we can also, we are sending monthly report to the respective departments so they can analyze their data and come up with solutions. And we're calling back all unattended calls and connect them again to the specialty before the end of the day. So for example, if the patient calls and he's waiting on the line because other patient is on the phone with the doctor, we call them again after a few times. The triage team will call the patient and connect it to the specialty, so we will solve their problem before the end of the day. We also can improve the patient satisfaction by conducting more surveys, and we can improve the standard of the service by establishing a policy for virtual medicine, including the urgent consultation, and providing mandatory courses for all staff involved in the telemedicine, for example, IHEAD courses. Lastly, we can improve the internal pathways by ensuring all specialties have internal pathways in their own way. For example, general medicine can have a connection with the GI, rheumatology, pulmonology, because these are subspecialties. They have no specialist dedicated for the telemedicine all the time. So we can have internal pathways through medicine. And we can have a fast track for urgent non-emergency patients to be seen as early as possible in the OPD. Thank you.
Thank you, Dr. Khalid, for your valuable insights and thoughts that you've shared with us today. Do enjoy the rest of your day.
Thank you.
Thank you.
Thank you so much.
Humanity, rising to the challenge of a lifetime. But we're not done yet. Better has just begun. Let's make healthcare reach everyone. Let's push this world forward, because together we make life better.
A wonderful message from Philips. Together we make life better.